Hello, and welcome to the Clinical Care Options Infectious Disease Podcast. I'm your host, Sarah Anderson. Today's episode is part of an ongoing series addressing misunderstandings in applying HBV or hepatitis B virus treatment guidelines. This series features brief conversations between a physician and a patient in which they discuss ways to collaborate in care and reach shared decisions, often describing their own experiences. In this episode, Dr. Tarik Asselah, Professor of Medicine in the Department of Hepatology at Hôpital Beaujon, Université de Paris, Clichy, France, has a conversation with his patient on the importance of screening for hepatitis B, taking medications for hepatitis B and goals of treatment, and how it is possible to lead a healthy, normal life while living with hepatitis B. Dr. Asselah also discusses the importance of hepatitis B vaccination as a preventative measure. For more information about Dr. Asselah and for a link to additional online education on this topic and more, please visit the link in the show notes. To Dr. Asselah and our patient, thank you so much for joining me today. I'm now going to turn it over to Dr. Asselah for introductions.
Hello, I am Tarik Asselah. I'm a doctor, a hepatologist in Paris, in Hôpital Beaujon in France. It's a public hospital. And I am taking care of patients with liver disease, including those with viral hepatitis, and also doing research at INSERM on clinical trials, drug developments to help to cure the patients. So today, I'm very happy to discuss on hepatitis B with one of our patient. Please tell us about your story.
Thank you for the opportunity given to me to share my story. The story that came to me as a surprise, I have to say. It was barely 3 years when I met my girlfriend that we decided to get more serious with our relationship. In the process, we had the option to go for blood analysis to ascertain some certain blood compositions, like the genotype, and also the blood group. When the test result came back and boom, I was positive for hepatitis B. It was a huge shock for us. It was a huge shock for my girlfriend at that time, who is now my wife. But here we are, living great.
So I think it's a very important message because it seems that the disease, hepatitis B, there's no symptoms. So we need to make screening, blood analysis to improve the diagnosis, because we know many people are living with Hep B and there's a risk of developing serious disease with cirrhosis, with liver cancer. So it's very important to screen to know the disease. So then, when you knew that you had this disease, what have you done?
Yeah, I think it's very true because there was no symptoms whatsoever. In my head, I was thinking I was 100%, healthy until I got this test and I was diagnosed to have hepatitis B. It was so devastating. Sleepless nights. Sometimes, you just wake up at night thinking about several things, different thoughts coming to your mind. But then over the time, I was able to overcome all those negative thoughts. And, I just rose up to the challenge and I felt this is life and life needs to go on. And most importantly, I'm really grateful for my wife because she was so supportive and, she didn't allow me to feel any bad during this situation, even when we got the news from the hospital. So far, life has just been good, living well. There's no negative vibe around me. I've been taking medication as prescribed. I'm sure we're going to talk more about the medication aspect during the podcast. But it's just been so great. Just few moments of downtime when you just felt like kind of negative emotions coming on and all of those things. But I think I'm also grateful for the kind of person I am. I was able to look beyond this test result of hepatitis B to see the good things in me and to see that I'm going to just, conquer what this test result is.
Yes, as you know, Hep B is a major issue. There's more than 240 million of patients worldwide. There's an excellent vaccine with high efficacy and safety. Unfortunately, it's not well implemented in many developing countries, and people, when they were babies, were not vaccinated. There's other mode of contamination with sexual relations. So I think we have to improve screening and also treatment. Treatments are very good, but they are not available everywhere in the world. So tell us about your treatment. So you take a treatment How is it? Do you have some restrictions, some limitation in your life with Hep B, taking pills?
Africa, where I come from, it's, you hear a lot of cases of hepatitis B, in those areas, and there is little or nothing the government or even the private sector is really doing about this, especially for people living in this health condition as mine. I'm really grateful for having this opportunity to have a good doctor such as you to at least encourage me to take a treatment. For me, I never even knew what treatment was. It was just good, but to be honest, it's not easy to be taking treatment or for you to know for the rest of your life you're going to be taking a treatment for this type of thing. But I think it all boils down to the state of the mind. You just have to face the challenge. It's been great so far. The treatment has so really much been helpful. I'm living healthy. Everything around me is just good.
Yes, the goal of treatment is to reduce the risk of developing cirrhosis, cancer. As you know, but you will tell us this treatment has high efficacy and good tolerability. There's no side effects, and it's just one pill a day. So I think there's many progress in treatment. It's very important to have a good compliance, because if you stop therapy, there's a risk of reactivation of active disease. So
Indeed.
I think it's very important, because we believe that the patient has a very important role in the way he has been educated to know the medication, to know the disease, to have a good, healthy life.
Yes, and also I think part of the education that was given to me during my process of examination, it's the fact that if I take the treatment, it's going to increase life expectancy, it's going to reduce to the minimum the possibility of having or developing a liver cancer, and also it's also going to help in decreasing the amount of virus in the body. So these are reasons I feel it's really important for me to take the medication or to take the treatment. If not because of the test result that I got, I wouldn't have known that I have hepatitis, because to me, everything just seems normal. I'm usually a person that doesn't fall sick. I hardly fall sick. I hardly go to the medical center. I hardly go to visit any hospital. At the end of the day, I ended up taking a pill, but of course, it's good for at least for the positive side, which is going to decrease the amount of the virus in the system, increase life expectancy, which is really good.
So tell us, so you have a good job, you have a good family, you have a wife who supports you, you have a baby. What messages are you willing to share with other patients worldwide, other doctors, people doing research regarding hepatitis B?
Thank you so much for that question. The message is, don't lose hope. Having hepatitis B is not the end of life. For me, they diagnosed me to be having hepatitis B, but then I am living a healthy life. I have a very beautiful son, and everything seems to be very fine with me health-wise. The advice there is just to stay courageous and to stay positive, even whatever the result is for you, or just take it with all, good heart, and also try to comply by what the doctor says to you, probably taking the treatment, number of times you need to come for examination and all. But then I believe there is no limitation to what you can do, to what you can achieve. In terms of job-wise, I may not know if there is any limitation to people working for someone, because for me, I'm an entrepreneur. I work for myself. But however, I think regardless of where you are, I believe you can still live a normal life even at your workplace, even having the hepatitis B diagnosis and all of those things. My advice to the doctor would be they should just try to reassure their patient whatsoever at all times, and also give them the message of hope that there is not going to be any problem, that they're going to live a healthy lifestyle, they're going to live like a normal people. I think a message of hope is really crucial for every doctor that is having a patient such as me.
Thank you. Thank you for all these optimistic, positive messages. They are very welcome. I think from my side, I think we have to implement also vaccine coverage worldwide. We have to implement screening with the availability of diagnostic tools everywhere to screen for hepatitis B, but hepatitis C and HIV together. We have to also have the availability of all treatments worldwide, because the treatments are very good efficacy and tolerability to reduce the risk of cancer. There's good treatments. We have to encourage compliance. And also, we have to improve research to try to find also treatments that allow an HBV cure, as it has been done for Hep C. I think so with this discussion, we share experience in Paris, in France, And we were very happy to do this experience with you.
Thank you.
Thank you very much. Have a nice day.
Thanks to Dr. Asselah and our patient for sharing that conversation with us. And thank you to our listeners for joining in. As a reminder, if you would like to hear short presentations on additional topics related to the care of patients with hepatitis B, I invite you to visit the Clinical Care Options website by clicking on the link in the show notes. And please be sure to check back regularly for more episodes on important infectious disease topics. Thank you.